Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, some of the highlights this hour. As the Eid al-Kabir festivities begin tomorrow, Ogun State government bans all forms of gatherings above 20 persons across the state, asks Muslim faithful to observe their special prayers at home. After nearly 4 months of suspended services owing to restrictions due to the SARS-CoV-2 pandemic, the Kaduna-Abuja train service resumes passenger operations. And a scaled-back annual pilgrimage performed by Muslims all over the world begins in Saudi Arabia, with international visitors banned. We begin with global figures of the coronavirus cases, which is now over 16.7 million cases. The death toll stands at 661,724, while close to 1 million people have recovered around the world. On the African continent, confirmed COVID-19 cases are put at 870,000, with more than 520,000 recoveries and almost 18,500 deaths. Most of the countries on the continent are still witnessing community transmission. So here in West Africa, Nigeria, the country is witnessing a daily rise in coronavirus cases spread, and this is across the 36 states of the Federation and also the Federal Capital Territory. You can also see different colors, about 4 colors, that shows you the spread of the cases. Now, when you look at the only state in red, that's the epicenter of the virus load, and that is Lagos State, which has over 10,000 confirmed cases, followed by the cases you can see about 3 states there, the FCT, and a few other states in the southwest. They're recording over 2,000 confirmed cases. And you have the others which are below 1,000, and just the states that are in blue, you can see that they have about over 1,000 cases. So we're looking at the spread of the confirmed cases in the 36 states and the FCT. Now, just in 24 hours, the NCDC reported 624 cases in about 17 states, plus the FCT. Lagos, of course, getting a huge chunk of that, about 212 cases. We'll take you to the number that has been discharged as well in the last 24 hours. Not as much as yesterday's, which was about over 800, but in 24 hours we saw patients discharged, 561 of them in Edo, Lagos, Ebonyi, Osun, Nasarawa. The list continues with some of the states you're seeing and their figures on those states as high as 100, and this is also different demographics, the male and the female. When you look at the total confirmed cases, our number stands at 41,804, and of course we have those that have recovered, over 18,000. We hope that that number continues to rise. But the cases that are active, and these are the cases that are currently in admission in Nigeria, stands at 22,172. Sadly, we have lost 868 people to the virus. The demographics are fairly the same. Sometimes we have male 73%, but we're seeing now men of that number, 26,866, 64%, and we have the women 36% in terms of the confirmed cases that we're seeing across the country. With more of these figures coming in, our case fatality ratio stands at 2.0%. We have joining us from our Abuja studio a public health professional and founder of Talk Health Niger. He joins us to talk more on the trends that we're seeing. Thank you so much for joining us on the program.
Thanks for having me, Millicent.
All right, Dr. Eze, with the emergency operations centers activated in the 36 states and the FCT, now, based on the figures of cases that we're seeing rise by the day, are the states alive to tracking the virus?
Well, I don't think the states are alive to tracking the virus because as at yesterday, according to the data released by the Nigeria Center for Disease Control, we've conducted 272,000 tests across the country. And 9 states have conducted less than 1,000 tests, and that's not progress. We have a daily testing capacity of up to 4,000 per day, but yesterday, less than 2,000 cases were tested. So is it because we already have community transmissions? So I don't think the states are doing enough. And I don't see reason why a state like, Taraba will be testing 499 when Gombe have tested, or close to over 7,000 cases. I don't see why Anambra should be testing 688 since the inception, while Ebonyi it has tested over 4,000. So only 5 states that have tested more than 10,000 persons, and that's not good enough. So we need to be focus more and get our states to do more because there's already community transmission. We already have a lot of cases being reported, many persons not even getting to health facilities, and many deaths occurring in our facilities. So we really need to do more.
So in doing more, do we need to change our case definition? Because, I mean, if you don't have any of those symptoms, you won't be presenting yourself for testing. So in terms of solutions, what should states be doing? Should it become compulsory for every citizen to be tested for COVID-19?
Well, we may not necessarily have to change the case definition, but since we have community transmission, every state, based on their capacity, have to define how they target those to be tested. I'm aware that some states have prioritized, I think it's a Boyanimo state, that say they've prioritized testing older people as well as, people with pre-existing health conditions like those with hypertension, diabetes, and all that. So those can be done, further expanding it, but that has to be done at the state level based on their capacity and based on a number of indicators they are looking at. But one thing is very important is that we need to test more because we can only know the cases that people that have COVID by conducting tests.
I'd like to finally ask you, the World Health Organization asked countries to be more precise in locating transmission, and precise decisions should also be taken in stopping the spread. And, seeing as you said that we are far behind in testing, are you worried that we still have a whopping 73% of unknown disclosure, or rather exposure of the virus?
Yes, I'm really very worried. The thing is, if you look at the environment and if you look at the attitude of some state governments, everybody appears to have moved on. And, there are a lot of signs of not taking this serious, even among the citizens, many who choose to believe all kinds of tales that they see on the internet and not adhering to the prevention measures, the non-pharmaceutical measures that the NCDC have recommended. So there's every reason to be worried. I don't really know how soon we are going to get to the end of this at the rate we are going at the moment.
All right, we'd like to appreciate your time. Thank you so much. Dr. Laz Eze, a public health professional. Thank you for joining us on the program.
Thanks, Millicent, for having me.
Now, the Kaduna-Abuja train service resumed passenger operations today, nearly 4 months after services were stopped due to the nationwide COVID-19 lockdown. The railway opened bookings for passenger services this morning with 4 coaches connecting Kaduna to Abuja. Railway health officials at the Rigasa train station told our correspondent that coaches and the premises have been decontaminated before resumption of passenger service. And in line with social distancing guidelines, the number of passengers per coach has also been cut down by half, while the railway management has made the wearing of face masks and the use of hand sanitizers compulsory.
I want to assure you that according to the NCDC protocols on the prevention and containment of COVID-19, the Rigasa railway station have done its best, and we as the professionals have been here since yesterday, standing for 24 hours to ensure that the needful is done. Number one, what we did and they did and we ensured was done was the decontamination of the train on arrival yesterday, the one that left in the morning. And the second one, which we are expecting around 9:15, as soon as the last passenger they embark from the train, it is also going to be decontaminated. And as you can see here, we have provided the footsteps here, as you can see them, for the social distancing, which is one of the among the protocols. Also, the NCDC has told the Federal Ministry of Transport that no traveler will be allowed into the train without wearing his or her face mask, as well as holding a hand sanitizer. That has strictly been adhered, and passengers are here with them. And in the absence of people, let's say, not knowing or getting this information about having to be with their hand sanitizer and face mask, we have made provisions and through the manager of the rail station to get some accredited people he wishes to come here so that they will be stationed somewhere to sell the face mask. And we as professionals, we will inspect such face masks to ensure that they are of quality and that they wouldn't pose harm.
The Ogun State government has banned all forms of gathering above 20 persons across the state during and after the Eid al-Kabir festive period, asking Muslim faithfuls to observe their special prayers at their individual homes. This was communicated by the governor of the state, Dakwa Abiodun, when the new chief imam of Egba land paid a courtesy call on him in his office in the Abeokuta state capital. The governor said this becomes imperative in view of the prevailing circumstances that dictate, of course, to solve the coronavirus situation.
As a government, we will always provide the ambience for all our people to practice their religious beliefs in a peaceful manner. If not for COVID-19, we would have been preparing for a bigger Ileya celebration. But the pandemic has come, and we pray that God will save us through this trying period. Baba Imam and all the spiritual leaders in the state should also continue to cooperate, support and pray for us for the successful implementation of our administration Building Our Future Together agenda. Let me state, therefore, that there will not be any form of Eid prayer or any form of gathering in Ogun State. Therefore, each family will have to observe the Eid prayer at home. We beseech our citizens to stay safe by staying at home. And there will not be any festivities or any gathering that violate the COVID-19 protocols of no more than 20 people at a time. We want to thank the entire Muslim Ummah for their thoughtfulness and consent that this year's prayers will be observed privately and solemnly.
We have more on the COVID-19 updates when we return. Please stay with us. Over in the South, the governor of Edo State, Godwin Obaseki, says his administration will continue to work in sync with other arms of government in moving the state forward, irrespective of the economic challenges presented by the COVID-19 pandemic. The governor also signed into law the revised appropriation of 129.8 billion naira from 278 billion.
COVID-19 pandemic, which no one predicted, has changed the course of mankind. It has imposed certain challenges which we still do not know how they will change the course of our existence. The financial and economic consequences of COVID-19 is as challenging, if not more challenging, than the public health crisis which it created.
An educationist, Olajumoke Balogun James, she is an education law enforcement consultant for the Dutch municipality government. She joins us via Skype from Netherlands. We'd like to thank you for joining us on the program.
Well, thank you for having me.
I'd like to begin by asking how Netherlands is doing containing the spread of the virus.
Well, right now we can actually be proud of getting the situation under control. In the recent weeks, we've not had any increase in the number of infected people. So we have actually broken the curve, as they say.
Because, you know, if you recall, April, you had, I think, your peak at that time, but now we're really seeing a flattening of the curve with recent reports. But I'd like to ask about the measures in terms of the lockdown. Countries have come from total lockdown to partial lockdown to schools reopening. In terms of education, are schools open?
Yes, we were open right until vacation last week. We had a partial opening, but most of the time the kids were still following their lessons online anyways. But at a particular time, sometimes beginning of May, kids could go back to school. So yeah, that was what happened till last week before the schools went on holidays.
So what was the experience for the students, the pupils? Could you share the kind of experience with regards to adapting this COVID-19 era?
Well, adapting was a little bit difficult, but the compliance level is very high in the Netherlands. You know, we are kind of law-abiding citizens, including the kids. So you see people, you know, reminding one another of the 1.5 meters distance, social distancing measures that was taken or still active now. And for the schools, it was maybe a little bit difficult at the beginning to get all the kids to enjoy the same level of education and quality as they had before the COVID started. And when they had to go back, because a lot of measures had to be put in place, we had to come up with strategies to make sure that we reduce the infection or the transfer between the kids and the staff. I mean, obviously, it was proven that most transfer were made between the adults and not kids themselves. And knowing that, it was easy to actually come up with protocol to make sure that the staff was able to keep their distance in the classes and within themselves. And kids were exempted from wearing masks at a particular time. So they could sit in class, they could do things together. Physical activities were allowed, are still allowed right now. But the adults had to be very strict and they had to follow the protocol as was stipulated by the health organization or the National Health Organization in the Netherlands.
So how did how did schools divide the children, for example, into classes? If perhaps you had a class of 12, was it the same number or did they spread them across classes?
Okay, we had about 7 measures that needed to be taken, and that was to guarantee that we had well-ventilated spaces. In classes where you had more than 25 kids, which obviously doesn't really happen often, but in some special schools, you have kids that are, you know, sitting together, maybe up to about 20, 25. They had to come up with a plan to make sure they made groups all over the schools. So the classes are splitted into 2 and they reduced the hours of lessons. So maybe the first group was coming in at about 8 till about 12. The second group will come in at about 1 till about 4 o'clock. And they made sure that the classes remained the same. So the cohort remained the same. So you can go from the first group to the second group. And that was just to make sure that, you know, the kids were able to get used to each other and to be able to know if eventually anything happens, to know where it came from and which group they had to deal with. They had to do that all over the schools. And in some cases where we were sure of kids with pre-existing health issues, those kids had to stay home. So those kids didn't get to go to school at all. They had their lessons at home and online. But kids that were certified healthy with no problems, they could come to school in cohort. And the teachers had to maybe do a little bit more, but they were the same teachers, they had the same hours, and they were the one that really needed to actually, distance themselves from other adults and not necessarily from the kids. Because there was a research and the data that they presented to the health ministry was that kids within the ages of 0 till 17 were not getting ill. Out of the total population of the sick kids in the Netherlands, we had just about 1.3% of the hospitalized patients were kids, were infected, and 0.6% had to go to the hospital. And so it's a really small, population of the whole population. And that said enough to know that kids were not really at such a risk if they continued school or their sporting activities or any other activities they had. And knowing that, we were able to come up with, protocol and strategies to make sure that every school was able to reach out to the kids, give them the lessons they needed, even if it was just, for a couple of hours in a day. And that was how we did it till the vacation.
Okay, so I guess, as Nigeria opens up with the exiting students writing their exams, there are many things that we can learn from the example there. We'd like to thank you so much, Olajumoke Balogun James, Education Law Enforcement Consultant. Thank you for joining us on the program.
Thank you for having me.
The annual Hajj pilgrimage performed by Muslims from around the world has begun in Saudi Arabia, dramatically scaled back because of COVID-19. International visitors have been banned from making the journey to Mecca to try to curb the pandemic. Only 10,000 pilgrims are expected, as opposed to about 2 million usually. Here's more now, Global Update.
Dr. Anthony Fauci has blamed the recent surge in cases on some states not following expert advice, adding that the height of the pandemic is not a time to be distracted by political infighting. Muslim worshippers began the annual Hajj pilgrimage today, and the event has been dramatically scaled back due to the COVID-19 pandemic. Amidst efforts to curb COVID-19, Muslims from abroad will not be able to attend the pilgrimage. Typically, some 2.5 million Muslims visit the holiest sites of Islam in Mecca and Medina for the week-long pilgrimage. The Olympics and Paralympics will be held in front of a limited number of spectators, according to the chief executive of the Tokyo 2020 Games. Toshiru Muto says the organizers are hoping to allow what he calls a limited number of spectators with full consideration of social distancing into the venue.
It is rather difficult for us to expect that the coronavirus pandemic is contained. But if we can deliver the Tokyo Games and Paralympics, I think it will become a role model for the next Olympic Games and other international events.
During the online meeting with Putin, Russia's deputy prime minister said the country's first potential COVID-19 vaccine will gain local regulatory approval in August. The production of the vaccine developed by Gamaleya Center will begin in September. More than 100 possible vaccines are being developed around the world to try to stop the COVID-19 pandemic. At least 4 are in final phase 3 human trials, according to WHO data, including 3 developed in China and another in Britain.
Continue to practice the safety measures as we go into the public holiday. Take a look at our website, channelsteve.com. It also has the latest updates on the pandemic. All you need to do is log on. You can access a lot of stories there. We can see that the German studies, sad situation in Germany. Half of the patients given ventilation died. There's several other stories. You can take a closer look. That's the program this time. Thank you for watching. I'm Millicent Nwaka. Stay safe.